What's up? Alright, here I am again, trying to give you an update on my treatment. Keep you posted as to what's transpired and how I feel and where we go from here. Today is August 21st, 2023. Not sure where I left off last time, but I had 2 chemo treatments so far. Last Tuesday was my last chemo treatment. Today is Monday, and tomorrow will be my 3rd chemo treatment. Last week was a little rough. At the beginning of the week, I had some pretty severe pain. Felt like a skewer from my throat up into my tongue, up into my nasal passages. And it was there constantly for a few days. And every once in a while, it felt like someone was just taking and twisting. That's the kind of pain I had. I talked to, not my regular doctor, but Dr. Lin, who was also a fantastic doctor. I explained that to him, and he had told me that, number one, to start taking the Lyrica that they prescribed to me, which I was kind of against, but made sense. It's a nerve-blocking agent. He said that will help with that pain and future pain. At some point, I'm going to need it, so get it. That's what he told me. Dr. Lukinson said the same thing. I wasn't fighting it. I couldn't get the prescription until last Friday, and then I decided to take it this past Friday, on the weekend when I didn't have treatment, so I was able to drive and get to the hospital. And I started it on Friday, and even before Friday, that pain kind of diminished, kind of went away. And what Dr. Lin said is, as that tumor shrinks, again, I had a 40 millimeter tumor in the back of my throat and into my tongue. It was 40 millimeters by 26 millimeters. That tumor was pressing on my eustachian tube for my ears, or my left ear, and it was pressing on my nasal pharynx, which was causing quite a bit of pain in my ear, and that pain resonated from here all the way up to the top of my brain on that side. Severe headaches for a while. So Dr. Lin said that should subside when that tumor starts to shrink. Now, I have no idea whether the tumor started to shrink. Just to catch up to speed, today was my 13th radiation treatment, proton treatment, basically radiation. I have some mouth sores. I got to start doing some rinses in my mouth. Constipation and digestion are still an issue. They were horrible last week again, after the chemo treatment. And my girlfriend, God bless her, she does more research than anybody I know. She did some research and found out that the drug that they have me on, cisplatin, there were tests or studies done with grapes and the byproducts of the grape seeds. So she went to the store and bought like $40 worth of all different kinds of very good grapes, Concord grapes. And she put them all in a blender, seeds, everything, peels, everything. She took the stems out naturally, but she blended them up, threw a little bit of sugar in there, and made me a drink. And it's supposed to help with the motility of your digestive system while on cisplatin, particularly. It will help you process food, perhaps help you eat, feel less full all the time. And it's supposed to help you with the constipation side of it also. Now, I just started that on Friday. The drinks are actually really good. They're all natural, and they're grapes, great grapes, I should say. They're fantastic grapes, and it's thick, but it's really good. It's just filling, so she wants me to drink 2 of them a day. I can only drink 1, maybe 2. I'll try, but I started out with 1. So that's what I'm working on for the digestion and the constipation side of it. And Dr. Lukens just told me to also try Miralax, because the scent I caught last week caused severe stomach pains in my lower intestine. I could barely stand up, sit down. Still didn't help really with going to the bathroom. So, aside from that, so the pain, the skewer pain seems to be diminished or gone. Whether that's the Lyrica or not, I don't know. The pain I have now feels like there are sores at the base of my nasal passage on that side, on the back of my tongue, and down my throat. It's not severe pain right now. It's probably a 4 on a scale of 1 to 10. Again, could be the Lyrica that's making it less. I don't know. Whatever it is, I'm glad I don't have the severe pain. So I met with Dr. Lukens. He said everything looks good. He felt my neck. Lymph nodes seem to have gone down. The swelling has gone down. My neck's a little red. The skin's a little red. He looked in my mouth. He saw the sores. He said that's normal. I need to start rinsing with a mixture of salt water and baking soda. The one other thing that we discussed was I asked him how long he thought this tumor was there, because I had told him about a year ago I went to my doctor and I told him there's something wrong with my left ear. It always felt like there was something in it. It felt like something, it was crunchy, like as if you had water in your ear, and every once in a while you turn and you can hear it go. It was irritating. So he sent me to an ear, nose, and throat doctor. I'm not going to mention his name. But he sent me to an ear, nose, and throat doctor. And it was in the Scranton area. And I went there, and they sent me in for a hearing test. And then he put me in a chair, and he said, "So what's the problem?" And I told him. He gets a scope and he looks in my ear. He said, "Yeah, you got some hairs in there. That's what's happening." He said, "You know, they make noise when you move." So he got a thing and he stuck it in there and started ripping the hairs out of my ear. It wasn't comfortable to begin with, but he started ripping them out, and I kept jumping. And finally, he went to the last one and went to rip it out, and it was on my eardrum, and I jumped like this. And he said, "That's it. You're good." He said, "That one's a little too close to the eardrum." He said, "You should be good now." Okay. About a week later, I had the same noise. 2 weeks after that, same noise. And then it just carried on, and I kept hearing the noise. This left nostril has been blocked for God only knows how long. I can't even remember. A year? I had terrible, terrible problems. I was in for CAT scans, and nevertheless. So I had talked to Dr. Lukens about it, and I asked him how long he thinks it's possible this tumor may have been there, growing. And his response was, "Okay, so you had this HPV virus, hanging out maybe 20, 30 years, hanging out in your lymph nodes or your throat or wherever in that area. And usually what we see is life-changing events, very high stress situations that lower someone's immune system and the body's ability to fight the HPV, and it comes out and it starts to grow into cancer. He said, now that said, there's no way for me to give you a definite idea, he said, but for the size of it, possibly a year, months. He said, it's hard to say. And I confirmed to him that I had gone through hell for the last at least 2 years. Life-changing experiences, stress beyond what someone should be subject to. Events that I couldn't control, some that I caused. One way or another, I'm pretty sure that that's how I ended up, how this came about. And Dr. Lukens just confirmed it. Anyway, so this tumor's been there for a long time. It took a long time for it to get where it was. Had somebody originally stuck a scope down my throat and saw it, who knows, I wouldn't be here, maybe. Surgery would have been an option, no chemo, no radiation. Less chance of it spreading. As I said, it had gotten into my lymph nodes. The lymph nodes are a highway to the rest of your body. So, I hope it hasn't spread. The other thing I discussed with Dr. Lukens today was, how do I know that we're making progress? I've had 13 radiation treatments. I've had 2 chemo treatments. Aside from the fact that I think the tumor may have shrunk because it's not pressing on my ear as much, how do we know we're making progress? At what point will you do a scan to find out where we stand? He said, okay, well, normally the way we work it is we don't do a scan. Your first and next scan will be 3 months after your treatment ends. And the reason being is trauma and swelling from the radiation will continue up to a few months after the treatment. The radiation actually continues to work for weeks or months after the treatment. It's there and it continues to work, killing cancer cells. So, with that in mind, they can't do a PET scan or a CAT scan accurately because the results are based on the inflammation and the trauma could give them a false positive. So that's why they wait 3 months. So even after these 7 weeks, I won't know if I'm cancer-free for 3 months afterwards. It is what it is. They're pretty confident that this treatment works and that this treatment will get to where I need to be. Other than that, I'm doing okay. I'm doing okay. As I said, I think I said last week, the mask, it's like it's not even there any longer. That doesn't bother me. First couple weeks it was scary. I'm breathing better. Pain is less severe. Again, we're only in the beginning of week 3. But we're getting there. You know, I had somebody tell me yesterday, while I was getting my Proton treatments after I got out, he came up to me, and he's one of the technicians that run the Proton treatment. He said, you know something? You're going to make it through this. I know you are. He said, and when you do, you should be real proud of yourself. Because this is not easy. And I told him I will. No 2 ways about it. Other than that, guys, I really don't have much to say except thanks to my sister and my brothers who support me every day. My girlfriend Rose, can't thank her enough for taking care of me. So all of that said, I just want to give people encouragement and let them know that's the reason for these videos, is to let them know that they can do this. I'm not a Superman. I'm determined, but I'm not Superman. If you have this problem, get to the right place. Do the research, or have somebody do it for you. But get to the right place for treatment. Buckle up your chin strap and get ready. It's a rough road, but it's doable. That's all I have to say for this week, guys. Back at the lodge, and I'm going to get myself all set up and get ready for my chemo for tomorrow. And got to try and pack on some calories somehow. I'm going to try and eat something. That's the other thing. I was down 10 pounds last week. Kind of stabilized it. And hopefully this grape juice is going to allow me to eat better, digest better, and alleviate myself better. Alright, that's enough talk for today. I'm out. Have a great day.